On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Jorge Casas, Dr. Andy Chung, Dr. Garner Newton, Dr. Bob Peters.
Hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center, the top medical center in the entire Dallas-Fort Worth area.
It certainly is, Jim, and not only do they have some of the top physicians operating right here, they also have some of the best technology. Up next, let's take a closer look at the Makoplasty robot.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside in what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically three compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using a robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
Hip replacement surgery and knee replacement surgery are two of the most commonly performed operations every year. In cases where patients develop an infection around an artificial hip or an artificial knee, a lot of times these cases have disastrous consequences.
I had 2 knee replacements in 2011, and both times they got infected. I talked to the internist and said, what happens if I don't do any more surgeries? Because I was miserably sick of having my leg sliced open and having to go through the rehab and the pain and everything. And the internist says, well, you'll die.
He had undergone a knee replacement for a worn out joint. He subsequently developed an infection of his artificial knee. When I went back to replace his knee, the defect was so large that I ended up having to reconstruct him with a design knee replacement that I typically will use for the cancer patients. Because he had already had a previous 2-stage exchange, he had a relatively large defect to reconstruct. So he required reconstruction of a relatively large segment of his femur bone. I had to remove approximately 4 inches of his femur bone because it was completely eaten away by the infection.
It's 100% better than it was 2 years ago. In all, he probably saved my leg, and he could have saved my life too.
The good news is that there's no sign of any infection coming back. He's still having some pain and some episodes of swelling, but he's better now than he had been for several years.
I'm able to do most everything I could do before, and when I pitched the pain pills, everything changed too. It makes you feel a whole lot better. Everybody says, well, bedside manner, it doesn't count. You've got to be a good surgeon. Well, he's a good surgeon. He's an excellent surgeon, and he's also a good communicator. So there's no surprises, when you wake up from the surgery. You know what you're up against, and you know what you had to look forward to.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
What we found is that there's a new technology for treating reflux that can get people off of their medications. The problem is, because surgery hasn't been used in 20 years or so, we didn't have a good way to evaluate the patients. Those centers were spread out throughout the state, frankly, and we decided that there was a need to have a center put together that could do all the different types of diagnostics that we need to identify reflux patients. Forest Park stepped up to the plate. They bought all the equipment. We got associated with some of the gastroenterologists in town that we hadn't done any work with before, and they've taken the lead to run the center, to do the diagnostics, and to give us the information we need to appropriately treat the patients. We do pH studies. We do pressure studies of the esophagus called manometry. We also do regular endoscopy to look and obtain pathology specimens. And the best test that we have now is called impedance. Impedance is a test in which we're able to actually measure the movement of fluid up and down the esophagus. So where the fluid may not show up in some of the other tests, for sure it's going to show up in this test. The difficulty that we had in the past was we were sending patients one place to get pH, another place to get manometry. We had to send patients down to Houston to get impedance. And so now having all that equipment in one space becomes very convenient for the patient. I think because there's so much information out there on the internet, on the TV, people understand that they have a problem. They have reflux, but they don't understand all the options that are available. When they come in to see me, I'm going to talk about their symptoms, how they relate to reflux, whether it may be due to some other disease process. We're going to talk about the anatomy. We're going to illustrate the anatomy to them in pictures. And then we're going to talk about the different tests that we need to do to confirm that this is actually what we're dealing with. And then we'll talk about surgery if it's indicated. And rather than having to send patients across the state to get that study done, it's something that we could do right here in Forest Park, Dallas.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts. Forest Park Medical Center, the top medical center in the entire Dallas-Fort Worth area, has some of the best physicians operating right here out of Forest Park Medical Center, including Dr. Garner Newton.
I was experiencing pain in the right shoulder up into my neck. I'd seen Dr. Newton before for some hip issues and thought he was the man to see. Dr. Newton took several x-rays, subsequently an MRI, and announced that I had a torn rotator cuff.
The most common way to tear a rotator cuff is really as we age, because of the blood supply and part of the rotator cuff is not very good, then it tends to tear.
I was concerned about my athletic endeavors with golf and swimming and the activities that I like to take part in. It caused me not to sleep very well or be comfortable in any one position for a period of time.
It's a very common complaint of rotator cuff tear is basically having pain at night that tends to wake them up and or they can't sleep on that side. The first thing you do is get a good physical exam. It's very important to get a good physical exam and history to see how they may have injured it, because you want to pick out if they injured it in a specific trauma or a lifting type episode, because it matters a lot on what you decide to do as an orthopedic surgeon.
Dr. Newton suggested that surgery was in fact the solution, that it would not heal itself and the pain would not subside. The discomfort would not subside. It was a very easy election.
The rotator cuff surgery is something that can be done either arthroscopically or through a mini open type procedure. The way I decide to do it has a lot to do with the type of tear, how big the tear is, and the patient. If we decide to do it through the scope, the incisions are obviously much smaller, but that would require, in my opinion, a smaller type tear that wouldn't require multiple anchors, multiple sutures like in a large to massive tear.
Dr. Newton made it very clear that with each patient and each surgery it could be slightly different. He was very optimistic that it was a routine procedure and that I would be pleased with the outcome, which I was. It's been 8 months. I feel fairly unlimited at this moment in time. I feel that I'm on my way to being 100%.
Mike, who loves his job working at a hospital, had chronic neck, shoulder, and back pain until he met Dr. Peter Beck. To find out more about Mike's story and other life-changing stories, log on to bestdocsnetwork.com.
The Association for Registered Dietitians, American Academy of Nutrition and Dietetics, does an annual Nutrition Awareness Month for March, and this is the 40th anniversary year. We promote nutrition, healthy eating, lifestyle behaviors, and physical activity. What Forest Park Frisco and I decided to do was get the staff involved by some healthy competitions. We work with American Heart Association to do some fundraising and put names of individuals who have raised a certain amount of money into the raffle as well, and those who wanted to participate in a jump rope contest were able to with a small donation.
One of the big things for the American Heart Association is just raising the level of awareness. And when companies take an active role in what their employees are doing, like Forest Park Medical Center has done, it really helps us raise that awareness. I know that Krista said she always gets a lot of questions about eating healthy, exercising, what do people need to do to take care of their hearts, and of course that always leads into losing weight. And so they really have been focusing on those things here leading up to this event. Many of the schools all across Dallas participate in an event called Jump Rope for Heart, where the students actually learn about eating healthy and taking care of their hearts, and they celebrate at the end of that event by jumping rope as a fun activity that can take care of their hearts. And Krista had contacted me and wanted to do something similar here at Forest Park. And it really led up to this culminating event today where they came out and had a little fun and showed support for the American Heart Association.
Congratulations. Forest Park Frisco decided that it would be nice to get the chef out. So we wanted him to do some kind of cooking demo to interact with the staff members that decided to come to the event.
For the tambouille salad, I've got some barley that I boiled off earlier, parsley, some mint, cucumbers, green onions, a little bit of celery leaf, diced tomatoes, fresh radishes, and cilantro. Give it a little bit of salt, a little bit of seasoning, put just a little olive oil in there to kind of bind the whole thing. Then for a little bit of acidity, use a little bit of lemon. Let's give it a spin. Today I'm setting it up bruschetta style. Have a little bit of rosemary ciabatta set up over here. Set it up like a little sandwich like this. Great for the summertime when you don't feel like heating up the kitchen. There you have it.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems. and/or nasal obstruction. Sometimes those patients can be helped with surgery, and typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
Forest Park Medical Center, of course, is one of the top medical centers in all of the Dallas-Fort Worth area, and lucky for us, they're expanding.
That's right, Candace. Forest Park Medical Center Southlake will open in June. Right now, let's get an update on this amazing facility.
Welcome back to Forest Park Medical Center Southlake. We've been busy. One of the things that you'll see in this edition, we're about 80% complete now. We have our exterior water features that are going in. We have our landscaping that's starting to go in now. If you're really kind of looking at the exterior of the building, you're seeing really the facade come to life now. You're seeing the limestone go up. You're seeing the rotunda that's taking shape. We're getting close to installing the copper top, if you will, that'll add a lot of personality to the building. You'll see the clock tower. It's really acting as a true icon as it relates to architecture. And you'll see the water features that are integrated into that as well. When you're coming into the building, that's when we're really going to wow you. If you weren't impressed by what you're seeing on the outside, when you come in, you'll see the 2-story, over 20-foot water feature. It's hand cut by an artist that's actually, even with the water off, has a visual impact that is going to be meaningful when you come in. As you proceed through the facility, you're going to see other things that'll draw your interest. You'll see the fireplace, you'll see the coffee bar, and just the overall scale of the facility is really going to be impressive. We wanted to stay true to the integrity of Forest Park Medical Center. You know, the things that are sacred is the chassis. And then it's our job as the developer to really put a new wrapper around that is personalized for the community that we're going into. So Southlake has a completely different feel than any of our other facilities. We're integrating more of the hand-cut stone, and you're seeing a lot of the darker woods and things that are really important to the community here. We're not changing how Forest Park and what made Forest Park successful. We're just really customizing our field. It's staying true to the vision of our founders with Forest Park Medical Center that said, okay, I want to deliver something different than what the community is seeing. And we believe we've done that here at Forest Park Southlake.
Did you know that Forest Park Medical Center is equipped with a high-tech tube system that sends stat lab work from any location in the hospital to the lab? This enables the lab to test samples quickly for better patient care.
Well, I woke up one day in early July, about 3 years ago, and had a small lump on my neck that I thought was an ingrown hair or something like that. But it continued to get bigger and bigger over the next several weeks. And that prompted me to see my regular doctor. So I ended up seeing an ENT, which he ran some tests. A week later, he diagnosed the cancer. I decided I need a second opinion, and I ended up in Dr. Andy Chung's office.
We sat down, I kind of discussed with him what I believe was going on. He had already had a needle biopsy of the neck mass, which confirmed that it was a metastatic malignancy called a squamous cell carcinoma. And he asked me what options he had aside from getting radiation and chemotherapy, which he was very concerned about.
Hearing the word cancer is something you only think happens on TV, or to someone in the paper, but when it happens to you, it is pretty scary.
I talked to him about a minimally invasive surgical option where I described how we could go in and remove the cancer in the back of his tongue, literally with no incisions.
The tumor on my tongue was fairly large, and when I saw a picture of it, it looked like a great big mushroom cap way back in the back.
You can see this is the lymph node on the left neck that Mr. McNeff noticed. After surgery, we repeated this scan, and what you see now is that this bright orange mass that was in the back of his tongue is no longer there. So you can see that that tumor is completely gone based on the PET CT.
It seemed like I recovered pretty much from the surgery in a matter of days. The worst part of this whole procedure was the radiation treatment.
Our goal is to preserve speech, respiration, and swallowing. And I think because of that and that preservation, patients are recovering quicker, and the potential complications are significantly reduced.
As always, for more information on Forest Park Medical Center or any of the amazing doctors that operate right here, just visit our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab. Now let's check in with our next Forest Park doctor. It's Dr. Robert Cloud.
I was told I had hemorrhoids, or what hemorrhoids were. I didn't know anything about them myself, except that to put a cream on them, and every time I went into the shower, they were falling down, which I didn't know. I thought they were trivial things, like a toothache or something would go away. It didn't happen.
Everybody has hemorrhoids, and they're anatomical columns or cushions of vascular tissue. You have internal hemorrhoids that are up inside the rectum that are covered by non-nerve-bearing lining. And they usually bleed, itch, prolapse in and out. External hemorrhoids, or the external portion of hemorrhoids, are covered by nerve-bearing skin. And therefore, when they swell or stretch or even clot, you can get a lot of pain.
I had no pain, which was unusual. I just had the falling down of my insides coming down.
William was having significant symptoms from his hemorrhoids, and he wanted relief of those symptoms, but he wasn't ready to have surgery. We dealt with the main problem areas with a treatment or two of banding and infrared laser, but I wasn't satisfied that this was going to eliminate his problem. And so I recommended at that point that he formally undergo internal and external hemorrhoidectomy, which he did, and he was very glad he did once he healed.
And since then, I've had no pain, no bleeding, no nothing. I can walk, run, and dance. I knew exactly where I was going because he had given me good advice. And it made my life a lot better, a lot easier. I'm very content.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
After Kemper was born, he had a newborn hearing test at the hospital. So we were taken to several other doctors to find out more about his hearing and hearing loss. We'd heard about getting cochlear implants and had done some research on them, and that's kind of the road we decided that we wanted to take.
A cochlear implant is truly a bionic ear. It is the only available full replacement for a human special sensory function.
When he was born, we found out in the hospital before we even left. You know, it kind of took the joy and excitement out of having a baby. You know, all of a sudden told that there may be a potential problem with your son. Because, you know, nobody wants to find out that something is, you know, wrong with their child, especially our first child.
It's a day surgery type procedure typically. Maybe small children and babies would spend the night. But this surgery takes no more than about an hour and a half to 2 hours to do. That portion is allowed to heal, and then a very specialized computer is used on the outside called the processor. And that processor takes all the sound in the environment, digitizes it, and sends it to the implant via an FM signal.
And when they first turned him on, he'd never ever heard sound. So they started him off very quietly and slow, so not to scare him, you know, because it's a whole new world to him.
And the second that we had our first appointment with Dr. Peters, he said, okay, you know, my staff will take care of everything, and they did.
In the case of Kemper, who was identified early and whose parents wanted to be very proactive, very aggressive in doing everything they could for him, they presented early on so that by the time I saw them and that we had completed all of the evaluations at 9 months, not only was he ready for an implant, but I felt he was old enough and he had grown enough that we could do both ears at the same time.
It really has changed his life. He turned into a different baby. He was just a lot happier, and it's just like his whole world kind of opened up.
But yeah, we think very highly of Dr. Peters.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com.
One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods, and I couldn't even walk sometimes because my pains were just really, really bad. They were sharp, and just getting around, it was just really hard for me.
Now, in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, and she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So Dr. Lux sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are. It depends on the severity of the symptoms. In her case, she was in pain, and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, you know, how long I was going to be out of work, and which is I was only out of work a week. I was there like probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lux.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring Forest Park Medical Center, the top medical center in the entire Dallas-Fort Worth area.
And for more information on Forest Park Medical Center, their fine facilities, or the amazing doctors that operate right here, just visit our website, bestdocsnetwork.com, and be sure to click on that Forest Park Medical Center tab.
All right, so long, everyone. We will see you next week.